Again, thank you so much for being here today. So below you'll see our Building Maine Network grant is doing the Clinical Educators Connect. The profession spotlight this month is on physical therapy. And we do have a couple presenters today. So I am also going to go ahead and show you your CEU credit. And this will also be at the end of the slide deck. So I'll keep it up at the end a little bit longer, so you'll have time to get that. We also have our disclosures. And then we have 4 presenters today. So I will hand it off to, we'll start top with Tara. So Tara, if you would like to introduce yourself, and we can just go down the list and then we'll get started.
Sure. Can you hear me, Meredith?
I can.
Okay, good, because I'm getting a sign that says my microphone's muted, but I just wanted to be sure. So
Yep,
hello,
you're good.
everyone. I'm so glad to see you all, friends alike. And today we're just going to be talking a little bit about the Master Adaptive Learner and clinical education. So I'm Tara Parody. I'm from the University of New England. I'm part of the clinical education team here. And we're happy to be working together with Hassan today to be chatting about some of these frameworks, just so that this language becomes familiar between the educational opportunities and settings and the clinic education opportunities and settings. So you can probably read the objectives, but very quickly, we're going to introduce today the Master Adaptive Learner Framework. This is coming up a lot in the literature. We're hearing it a lot at education leadership conferences. So it's becoming a thing for us in education, and we're going to discuss how these techniques can advance clinical practice. We'll explore a little bit the use of the techniques in both classroom and clinical ed, so that we have a chance to work together to strengthen the students' skills, their self-reflective skills, emotional intelligence, et cetera. And hopefully we'll be able to have some conversations about applying the MAL techniques to encourage both clinician and student practice at the top of their license, and discuss any of the benefits of using the framework, and have some questions and answers at the end. So I'd like to just introduce to you in my slides this graphic here, this what is the Master Adaptive Learner Framework. I know that this graphic is probably too small to be reading on the slide itself, but it has, can you progress the slide for me? Thanks so much. I'm progressing my own as we're going along, so forgive that gap. So I'm looking at this graphic on the left here, and I know that it may not be easy to read with all of those gears, but what I'd love for you to be able to see are the 4 gears there that I'm going to be talking about, and then this little box down at the bottom of that framework that says coaching, and then these tiny batteries. So we're going to be talking about what this means with regard to the framework. So the Master Adaptive Learner Framework is an educational framework. It's again based on a metacognitive approach. So we're talking about the students having them learn how to think about their thinking. That's the big piece. Like, how are they thinking about learning in the classroom or in the clinic, and what might be missing? And how can we help them get to that place where they can self-identify the pieces that they need in order to be the better learner? So the framework talks about awareness and understanding of one's thought process. It's definitely intended to leverage both efficiency and innovation. So when we talk about reflective models, we want the students at the end of their clinical education, and as a master clinician, we want to be able to think and pivot in the moment when we have to do that within patient care. So this framework is intended to leverage both efficiency and innovation. How do we get them to that place? And then this model is based on the idea that clinicians should be able to balance both their routine activities. We know that you all are engaged in things that you have expertise in, and also what is now adaptive expertise. How do we make that pivot into something that is new and different that we need to do and learn and apply? So next slide, please. So here's a little bit bigger, these 4 phases of the Master Adaptive Learner. And we're going to start in that upper left-hand corner with regard to that planning phase. And so the planning phase is where the student is asking questions of themselves. They're prioritizing and they're goal setting. This is the place where they can identify a learning gap for themselves, and they're saying, okay, there's between A and B, I need to learn all of these techniques, and this is how I'm going to put this together. The next gear is the learning gear, as we're going sort of counterclockwise, where they do a critical appraisal of, oh, these are going to be my learning techniques. Here's how I'm going to put together some learning sessions and strategies. And now I'm going to try and make this process work. The third gauge is, or the third gear is the assessing one. And this is about informed self-assessment. We'll touch on this a little bit later. But the student needs to not only self-assess, because sometimes they think they're doing a great job and there's pieces that are missing, that a skilled clinician is able to fill in those gaps for them and those blanks. So this is where they have to take an informed self-assessment with feedback and be able to assimilate that into their learning and be able to tolerate getting feedback and not have that throw them off so that they can no longer apply their learning skills. And then the fourth phase of the learner is that adjusting phase, where they're going to be implementing both routine and novel applications of their new skills into their practice. So if we could progress this last one with the batteries. All right, I just want to blow this up, and I'm looking at my own notes here. So you can see this was at the bottom of that framework. And this is where we're starting our work from the clinical education perspective and in some of the didactic programs. So you see the big square, it's called a rheostat. It's like a thermostat. And it's basically the role of a coach. And the coach, you can see, is helping the student get to those batteries that are going to energize their learning and also help promote them to get up into that, that headspace of all of those gears to do that training. So in order to give energy to keep the cogs moving in that metacognitive process, they need to have this energy source. And this comes from the batteries of curiosity, motivation, mindset, and resilience. And these are the areas that both you as clinicians and we as clinical education faculty also can have an impact on student learning. By creating psychological safety in a situation, we can get to the place. Curiosity is one of those pieces that requires psychological safety of a learner. They oftentimes can't get into that curiosity phase when they are so stressed out about failure and not being able to be successful in the clinical experience or not daring to ask a question. So we really want to get them to that place of curiosity. Motivation, it will be a question. You will assess your student and we will help give them some support to recognize whether or not they are extrinsically motivated or intrinsically motivated. And that intrinsic motivation is really what we want to tap into in order to get them in that growth phase. And then resilience. So these are going to be the areas that we will take a look at. And I skipped over a mindset there. So I'm sure you're familiar with some of the mindset language that's out there, but we want to also have the student self-identify when they have a fixed mindset in their learning process in the clinic, and when they're actually ready to move on to a growth mindset. So coaching skills and competencies can be reviewed. As a coach, you'll have a specific role in helping the student self-identify where they need to learn, how to set those measurable learning goals and objectives, and then how to help the student identify what resources are available to meet their own specific learning goals. And this is also going to affirm their techniques that they have with regard to student learning. And so as I hand over some pieces to Amanda, the recognition is that we can partner on one end to empower the student in the cognitive, psychomotor, and affective domain. And Amanda is going to give some more information about those pieces.
Thanks, Tara. So my name is Amanda Benner. I'm also part of the clinical education team at the University of New England. And I want to help apply this master adaptive learner framework to the clinical education setting. So Tara set me up so nicely talking about the affective, psychomotor, and cognitive domains of learning. And in clinical education, when students start to have problems or when they struggle with their learning, within those gears that Tara introduced of the MAL framework, typically it has to do with the affective domain. So less frequently, we have clinical instructors that are concerned with students' ability to develop their manual muscle testing or goniometry skills. So those would be examples of those psychomotor skills or habits of the hands, as well as their didactic knowledge, which they're getting in their classroom, so that content knowledge. But oftentimes, we have clinical instructors that are coming to us with behavioral or professional concerns that are sort of within this affective domain, which we can also refer to as habits of the heart. So there is a really great Sarah Silly lecture that refers to these learning domains as habits of the head, heart, and hands. And we really need to integrate all three of these in order to have a high-performing student. And it's the clinical setting that really helps us develop these habits of the heart, not so much in the classroom. And that's why these clinical rotations are instrumental for students learning so that they can really develop and cultivate the therapeutic education alliance with their patients, with their CI, and with their clinical education teams. So go ahead and advance. And when you're working in a clinical education setting to develop the affective domain, sort of thinking about this in the context of MAL, you're trying to promote resilience and emotional intelligence, that growth mindset. Students are doing lots of goal setting during their clinicals, that collaborative learning and feedback. And when we're talking about these pieces of affective domain development, that's directly connected to these batteries. And it's the batteries that we said that energize this master adaptive learner framework to help students create that kind of lifelong learning and adaptive expertise that we want them to have as reflective practitioners when they graduate from their programs. Advance. So how do we do that? That's all very theoretical. So how do you work on addressing the affective domain in clinical education, regardless of whether your student is struggling or not? It's really up to the CI to help cultivate these behaviors. So clinical instructors play an integral role in developing affective behaviors. Again, it doesn't have to be for the struggling student. That's just where we tend to have those conversations. So we would like to promote taking a strengths-based approach. Go ahead and advance. And we, in our program with the clinical education team at UNE, we take a strengths-based approach through the use of character strengths, specifically an evidence-based program called the VIA Character Strengths. You can visit their website for more information and to take their survey. And we use character strengths to talk about positive traits such as kindness, gratitude, humor, resilience, curiosity, and use this in the context of building self-awareness and reflection during clinical education experiences. And this helps students build resiliency and efficacy and adaptive learning because we can use a positive framework to have those harder conversations about areas that students might be struggling in. And then this helps them build that adaptive expertise and supports this positive giving and receiving of feedback that might be really challenging. Go ahead and advance. So this just gives you an example of something from the VIA Character Strengths.org website. This is called the Golden Mean tool. And this is the specific tool that we ask students to use when they're reflecting on their weekly planning forms about their top character strengths. So specifically with the affective domain, a student might be talking too much to their patients, and this is causing sort of a sequela of problems. So maybe they're taking up too much time, they're going over because they're not staying focused on the task at hand. So the clinical instructor can say to that student, what are your top 5 character strengths? How are you over or underutilizing those strengths? Maybe we can find a balanced strength or a balanced use of these strengths so that we can address this problem, which is essentially that you're talking to your patient too much. And so recently we had that scenario with a student, and their top character strength was kindness. And so we said, okay, well, perhaps you're overusing kindness in this context. And that allowed the CI and the student to have that challenging conversation, which can sometimes feel like a personal attack on their personality in a very constructive way. So here you can see this is just a snapshot of the 24 virtues and strengths, but you can see that creativity, when it's optimally being used, then you're sort of flourishing in that area. So that's, you're using your creativity. But if you're overusing it, you could potentially come across as eccentric or odd or scattered, versus underutilizing it, dull or conforming. So if a student was having a hard time with patient education and creativity was one of their top character strengths, you could say, how can we leverage creativity to help you with that area that you're struggling? Advance. And so by taking this strengths-based approach to addressing the affective domain, this is going to help make sure that those gears within the Master Adaptive Learner Framework are moving and not essentially getting stuck. And when we say stuck, we essentially mean sort of problems with performance or problems with learning. So this helps clinical instructors manage students that may present as challenging students. So that can be really burdensome for clinical instructors, and we recognize that. But taking this strengths-based approach really helps clinical instructors give students real-time feedback by framing these challenging situations with common language and this positive outlook. And then asking students to reflect on all of these pieces, including building that growth mindset and reflective practice, really helps to start shape their evolving professional identity as a student. Hand it off to Stephanie.
Thank you, Amanda and Tara. For those that don't know me, my name is Stephanie Loprino, and I'm the Director of Clinical Education here at Hassan University for the physical therapy students. So I'm privileged to be joining these wonderful people on this presentation today, and thank you for joining. I'm going to move into talking about the professional identity formation aspect of moving that student to being a clinician. Right, there are differences. We know that from all the years and all the students that we've taken, that there is a difference. But what we want to just kind of prioritize here with the MAL framework is that we need to start this early. So on us in the academic side of things, we try to start to develop these skills and these teachings and techniques with the students as early as we possibly can. Use of different learning activities, reflections, ICE, integrated clinical experiences. Hassan has a pro bono clinic. We try and focus on utilizing that in the moment with the students when they're in a clinical setting, case studies, things of that nature. As Amanda mentioned, a lot of this comes with just making them and showing them how to be more self-aware and giving them tools to improve their ability to reflect. The other thing with the professional identity formation is getting them to understand health system science, health systems as a whole. Where do you fit in as a student, as a PT student, but also as a PT after you graduate? Where do you fit in amongst the entire healthcare systems that you're going to be working in? We want them to be able to start to recognize where the gaps are in health systems, within those systems, but also within themselves, and help them develop strategies to help close those gaps. If they have any personal learning gaps, this is the time that we need to do that, as well as their general well-being, recognizing where these gaps are, but making sure that that doesn't negatively affect their well-being. System gaps are definitely more challenging than the personal gaps. Obviously, they lack some of the knowledge of those health systems. And so getting them to understand and think and view with a broader lens about what the systemic issues are, it can help them come up with ideas to take a more proactive stance. Students generally do have a hard time with this because they're developing their professional identity and they still don't know where they kind of fit in yet. And so they're working more on their individual personal goals. And so seeing those systemic goals is just sometimes just not in their immediate focus. And the other part of that is just trying to get them to recognize and realize what a positive impact high value care can have. Also interprofessionally and collaboration and teamwork with other healthcare professionals within those health systems. Next slide, please. And so one of the other things that we wanted to talk about in regards to the professional identity formation, moving that student through to clinician, is that sometimes those characteristics of a struggling student also become characteristics of maybe a clinician who might be struggling, or as Tara said and Amanda said, when those wheels, those cogs in the process get stuck, or maybe they didn't have a lot of guidance to help work through that when they were a student. So some characteristics of a struggling student they can appear disorganized, they can have trouble with time management. There's unrealistic expectations, generally that they put on themselves, trouble meeting deadlines, and they're actually surprised by their own inability. They think they know it, and then the outcome isn't what they expected, and they're actually surprised by that. They didn't realize why that didn't work. So how do we help? How do we help the student? How do we help move them through that process to become a more reflective clinician and help reduce some of those struggles that they encounter? So it depends on what phase that they are struggling in. So if it's that first planning phase, sometimes just asking them to reflect on what their learning strategies or their planning strategies are. Ask them about their prior performance in another setting. So sometimes when our students go from outpatient to an inpatient clinical, the complexity changes, right? Things are, there's more machines beeping, there's lines, tubes, things get more complex. And sometimes they can reflect, but they are very overwhelmed in this new setting. But sometimes just pointing out what the issue is can be helpful enough for them to come up with a solution on how to fix that. If it's stuck in the learning phase, the learner has generally subpar knowledge base of the context, but they still appear motivated and organized. They might be fatigued. They might report that they're a bad test taker. But we can help improve on our end, but also on your end as clinical instructors. We can improve their knowledge base with certain learning strategies. And we can give them readings to do, give them articles to look at or research. They can even do flashcards or Quizlets. Any kind of learning activity to help reinforce that knowledge and improve it. If it's the assessing phase, we can recognize the problem and create a plan. The student can recognize that there's a problem and can create a plan, but doesn't have the ability to see where the barriers are or to modify their approach to meet the needs of the situation. Some clues that this might be where they're stuck is that they do demonstrate that adequate knowledge, but the outcomes are not as good as expected. They can describe what the expected outcomes should be and the appropriate strategies to achieve them, but they have trouble with the operational side of things, the logistics. And their self-assessment doesn't really match what the supervisors or their peers' assessment is. So in this case, the learners will need help with their informed self-assessments, which I will talk about in just a moment. If they're stuck in adjusting, this involves incorporating new learning into one's routine or practice, but they have trouble deciding how to apply this learning to new situations. They have trouble seeing the bigger picture. They have realistic goals, but they have difficulty implementing them. They're unsure how to navigate system-level concerns. So this is where they're on clinical and something happens where they need to go to the social worker, but they might not know who, where, and what they should be telling the social worker about that person's condition. So the easiest way to help them with the adjusting is to take those bigger picture items and just break them down into smaller tasks. And the next point, unguided versus informed self-assessment. That was brought up a little bit earlier about the informed self-assessment. If it's unguided, it's when the student makes a judgment on their performance without examining those external factors and external information about that performance. So that's generally, they're just taking what they're feeling, what they're seeing, and that's the feedback that they're running with for their self-assessment. And an informed one, as mentioned earlier, the student makes a judgment on their performance, but it's multidimensional and it includes both internal and external information. So an informed self-assessment, you're seeking out feedback from others and you are trying to make sure that you're getting all of the information before you can go ahead and move forward. And next slide. And lastly, we've been talking a lot about the reflection piece. And obviously there are some nuances and differences between when students at a student level, as well as that new grad phase, those first couple of years of being a new grad. And then as we move through the career and start practicing at kind of the top of our license and transitioning into that role of being an expert clinician. We have the reflection in action and we have the reflection on action. So obviously in practice, that is more of an advanced practice. The students try and do it. Some do pretty well at it. There are others that struggle a little bit. But this really becomes standard practice to us as expert clinicians when we're in the clinic. We can, you know, we're on the fly, you know, we can, we're thinking on our feet. It's very intuitive. And this is something that as the new grads get out in the field, that they learn a little bit more because now they don't have that CI, you know, to back them up as a student. So reflection on practice, this obviously is after it's done, taking a step back, assessing the situation, seeing what went well, what didn't go well. We're often asking our students to do weekly reflections on their clinical experiences to try and find out, you know, those answers. And if they knew where to find resources that are besides the clinical instructor, because they can easily just ask you and you can easily just tell them sometimes. But oftentimes we ask them, besides your CI, what other resources did you use to help find information to improve upon this situation? So, but despite the reflection on practice is actually very important for all of us as well, but it's usually what the student, especially the new students, are doing. But despite this, this is part of that professional development process. This is kind of when it starts. And so what I would like to do then is transition over to Kimberly Steinbarger, as she is going to continue to talk about the clinician and the students and how MAL techniques work for practicing at the top of the license as well. So Kimberly, floor is yours.
All right, thank you, Stephanie. I'm Kim Steinbarger from Husson University. I was a DCE for many years and I've transitioned to a faculty role. So I just want to talk about how you can take the MAL framework and you can elevate your practice. You know, we all get burnt out, right? And you're looking for something different to do. You can also do this with the students. This framework is a great way to take somebody's passion, find their passion, and marry it to an elevation in practice in a primary care role. It hits all those motivation buttons that we've been talking about with motivation and mindset and resilience. You know, if you can take something that somebody is really into, it's a great way to elevate practice and to do it. You don't even realize you're doing it, actually. Go ahead and next slide, please. So APTA position on population health. Yes, we do this, right? So, you know, there are a lot, again, for that primary prevention, that primary care type of role is a great way to have the student think bigger. So, you know, there are a lot of areas that you can go for. You can do falls prevention. You can address healthcare disparities through advocacy. You could address aging and changes related to aging. You could pick a chronic condition that you like. I love to talk about rheumatic disease and how that affects a patient's lifestyle. You can go with the workplace injury prevention, community-based injury prevention. There are a lot of possibilities here when you look at the APTA's position on population health. Next slide, please. Okay, also PT's role in health promotion. Okay, so promoting health, you know, obviously we can do active living. We can talk about active living, that's our thing, right? But we can also talk about healthy eating. We can talk about stress management. Our students learn motivational interviewing techniques to talk about tobacco-free living, preventing drug abuse. If a student is really interested in pelvic health, that reproductive and sexual health area might be very interesting to them to kind of expand their practice into. All right, let's go to the next slide. Okay, so how can you encourage a student or yourself, if if you're looking for a change, how can you encourage to think bigger outside? Students are so focused on that patient and their wrist or whatever it is they're treating, right? They're so focused on the wrist. So we're trying to get them to think in a bigger context here. So using the wheels for the MAL network planning. So the first thing they're going to do is a needs assessment. Where are the gaps in their practice? Where are the gaps in the patient population? Community education, where are those gaps? And what's the best way to reach that target population? So again, they can look at the gaps, again, marry it with what they're passionate about. And they can elevate, you can elevate your practice, or they can elevate their practice right then and there. Okay, so, do they want to do a weekend event? Do they want to look at advocacy type issues? How do they want to, how do they want to plan this? Once they've picked a topic and they've picked a target, they can go to the learning wheel, right? The learning wheel is now you got to learn everything you want to know about that topic so that you can bring it on to the next person. Okay, it should be evidence-based, obviously. Healthy People 2030 is a great resource. If you haven't looked at that, it has benchmarks for every area of the country for targeting gaps in either access or healthy living. That's a great resource. I always send the students there for their health and wellness class to look and see what are the gaps in this area, according to the website. Go ahead, next slide, please. Okay, so then again, thinking big. So once you've done the planning and the learning, so then you do the event, whatever event it is, and afterwards look at it. Look at the event. Say, okay, what worked? What didn't work? Did you meet your goals for the event? Were you excited about it? They can not only assess how the event and do program evaluation of the event itself, but also, all right, did this increase my motivation in this area? Did this increase my, my mindset? Did I think of all kinds of things I could have done differently? That's that growth mindset that I didn't do it perfect the first time. And to be able to say that and to understand that is really part of that reflection piece that Stephanie talked about. So after you do that assessment, there's that adjustment. So am I going to do this again? If I am, how am I going to do it differently? Again, there's that growth mindset. And, I didn't do it perfect. I'm going to do it again. This reflective piece is really, it's crucial for this framework. So we'll go to the last slide. So in summary, kind of summarizing the whole thing, this master adaptive framework, if this is something, this kind of piqued your interest, you can use it to foster flexibility in thinking for clinicians and students, all levels. Okay, it's a tool that can be used to address effective behaviors, which, in clinical education, a lot of times it's not necessarily the skills, it's those affective behaviors that are the problem. And those are hard to address. You can use this as a tool for that. Apparently I have number 1 all the way down because it's all important. It contains language that is becoming more common in the academic setting. So we'd really like to kind of translate that into clinical practice and make it a more practical thing. It can be utilized to assist students in development of their professional identity and can be used to elevate practice to the top of your license. Whether it's you or your students, you can use those population health promotion roles that the APTA has set out for us in order to, follow your passion, find the needs in your community, and do something you enjoy. So I think we're going to open it up to questions. Discussion. And here's the CME in case you needed that information.
I'll leave this up here for a minute so you can screenshot it. So again, just opening it up to the floor. Does anyone have any questions? Yes, Chris, you're on mute.
Hi there. Thanks, Tara and Amanda and team for the presentation. I wanted to give you a chance to expand a little bit on how master adaptive learning can help interprofessional education and practice for learners and clinicians.
I'd love to take a shot at that and would love for anybody else to chime in. And thanks for that question, Chris. I think that the Master Adaptive Learner Framework is actually coming out of medical education as a whole. And that doesn't mean that it can't be utilized with other, with the adaptive learning skill set, with other sort of students, you know, even in the undergraduate world, et cetera, but it's really great for the healthcare professional teams. So certainly we've used in an interdisciplinary educational didactic experience at UNE, we've utilized some team building opportunities with Master Adaptive Learner utilizing the strengths-based approach. But I think that in every student group that is going to be caring for a patient, the students have the learning aspects where they are transitioning from school into the clinic, and then they find themselves getting stuck and have that fear point or that discomfort point about how to ask a question, where, and then to self-recognize when they get into that affective domain sort of spin, they have a hard time figuring out what the learning activity is without doing some of that negative self-talk about failure. So the actual structure of the Master Adaptive Learner, if the student is being guided through that process well in a position of psychological safety, then they can hopefully be able to kind of pinpoint in those four cogs, like, where's my gap in learning? Oh, how can I get to that place? What are my resources in order to get to that learning activity? And I think they can do it in a professional manner. So I think, you know, professions can do it together in teams, but certainly I feel like every healthcare professional has that desire and need. And I'd love to hear from someone else.
I was going to just chime in, you know, on the flip side at Hassan, we often do a lot of, we have a simulation center, and we do a lot of interprofessional simulations with primarily PT, OT, but we do work with pharmacy and the nursing students as well. But we're PT and OT are very closely related. We tend to do a lot of, I know Kim does a transfer simulation that is worth PT, OT, cardiopulmonary. We also, that class, we do a simulation where they do a co-eval, you know, on a patient, but we aren't telling them that we're using MAL, you know, but we are having them collaborate, do the planning, right? Then they do the learning, they do the simulation together, and then they do the assessing, right? And then they reflect on what went well, what didn't go well, what did the OT address that I should have addressed, or you know, vice versa, all those collaborative things of working interprofessionally. And then they do a reflection piece about what they could have done, you know, what they're going to do the next time, or what they could have done. And then that ends up playing out where at the very end, they do a final simulation for the semester, for the course. But it takes, like Tara said, it takes away that that psychological fear. You know, it's safe, right? You know, practicing with your peers. And that seems to really help prepare them for when they do their final simulation at the end of the semester. And then that has actually carried out into their clinical practice when they're on clinicals. They've come back and reflected and said, thank goodness for those, because I did so many co-evals with the OTs at the hospital, and I knew exactly what my role was. I knew exactly what I was supposed to do, and I didn't feel scared. You know, I'm a student doing an eval with the lead OT at the hospital, and it went, you know, it went amazing. Or, oops, I forgot to assess this, but she picked it up for me. You know, so translating that into the clinic has been much better since we've been doing those IPE events with some interprofessional other professions within the university.
Chris, I thank you for your question. I just want to add that I think that this framework is really, really instrumental in terms of dealing with some of those health systems that Stephanie alluded to. So we're talking a lot about healthcare in general and how it's evolving and changing. And there's a lot of discussion about burnout and moral fatigue and pieces like that. So if we're working together in IPE teams to kind of attack these complex problems, and we're working on building up those batteries of resilience, curiosity, motivation, and what's the other one? Mindset. I'm looking at my cheat sheet on the board. Then that's going to help the team, you know, attack these complex problems in these health systems with kind of energy, and collaborate with one another and have this sort of like lifelong learning excitement about these hard, complex, and hard problems versus leading to burnout. So just wanted to make that point too. For those of us that have done it, we know what that feels like. And sometimes I think some of us have been doing it and we don't realize that it's the MAL framework, but being more explicit about those reflective pieces is important.
A great question, Chris. Does anyone have any other questions? I just want to thank everyone so much for your time, and a thank you to UNE and Husson for being so collaborative on this joint venture. I really appreciate it. I definitely learned a lot just during the planning process, and how can I use the MAL framework for other aspects? So thank you so much, and this will be up on our Building Maine Network website, so you can visit clinicalrotationsinmaine.org. And you can also check this out on the iHELP-Maine platform as well. So thank you again so much, and I hope you have a great Friday.
Thank you.